Hi, my name is Dr. Christopher Lettingham, and I am the Senior Associate Dean in the College of Health Professions, Assistant Vice President for Faculty for the College of Health Professions, but most importantly, I'm a professor at the University of Texas Rio Grande Valley in the Department of Health and Human Performance. I want to take some time to talk to you about pathways to health at UTRGV. Because let's face it, health is important to all of us. Whether it be we have an issue with our health or if we have a desire to become a health professional. So here are the pathways to health at UTRGV. But I want to give you a little bit of background before we jump into this. We have a need for partnerships at UTRGV because to create the next generation of healthcare providers, to educate tomorrow's healthcare team, we have to have a partnership developed with everyone, but especially with our K through 12 educators who are preparing students to make that big step from high school into the university on their pathway to becoming a healthcare professional. Our job, yours, mine, everyone who engages with these students, is to identify and motivate disadvantaged youth to enter the health professions. Let's face it, if they get on the right pathway, it can be life-changing, not only for them, but for their future patients and clients that they interact with. Now, to do this, we have to have a governance structure that is reflective of true collaboration, where everyone takes a part in the ownership of the training of tomorrow's healthcare team. That means we have to make sure that institutions of higher education like UTRGV are at the table, that our school districts are at the table, that our community-based organizations are at the table, that our employers, our governmental entities, all the right people need to be at the table so we can join together to create the best possible environment to develop high-quality future healthcare providers. Now, how to do this at UTRGV and how can you help us? Well, we need to work on our academic enrichment. We need to do this at all levels, whether it be an academy model or through summer camps, but we have to give our students the tools they need to succeed. We have to have the academic support in place, starting in pre-K all the way through that master's program or doctoral program or professional health program. We have to make sure that students are ready to apply, so we have to have admission criteria that is clear, that they can work towards starting at a young level. We have to have mentoring. We all serve as mentors to our students, but we need to employ mentors from outside. We need to bring in the healthcare professionals, the doctors, the nurses, the speech language pathologists that are in practice to come share their story and help guide our students at every level. Now, that doesn't mean our students have to go in and do hours and hours of shadowing and internship and practical experience, but our students really need to make connections. They need to learn about the career from the people doing it so they can decide, is this something I really want to do? When we're little, a lot of us talked about being doctors or nurses because it seemed cool, like to help people. But some people, when they find out what they really do, they get turned off. It's a little gross, or they can't handle the sight of blood, or they really can't deal with people. So mentoring helps with that. We have to know all the different professional opportunities that exist. I mean, the pathways I'm going to show you here in a few minutes to UTRGV is just one set of pathways, but there are many pathways to health and healthcare careers. We have to make sure that we have financial support built in. And financial support in the form of grants, scholarships, loans if we need to go there. But students have to be able to pay their way through, get the support they need. But we don't want them to come out at a disadvantage and owe hundreds of thousands of dollars for a career that's not going to generate that. So we have to be smart about how we present this. We need to have parent and family empowerment. When we are educating students, We have to remember, we're not just educating the student, we are educating the whole family. We have to let them know what it takes, let the families know how they can be supportive, how they can empower their students, and we have to empower them to do that. We have post-baccalaureate programs that are really rigid and hard to get into. We want to make sure our students are prepared for that, and that preparation starts way back in elementary. We also want to make sure that we have student research experiences so they can see the science behind the practice. We have some programs where we offer pre-admission. Students can apply in high school and get on a pretty strict pathway if they do everything right to medical school, to our physician assistant program, and other programs are coming along in those lines. We need to work out the idea of meta majors. Sometimes students start college and they're interested in one area, but then they change their mind, but they still want to do something in healthcare. They've got to be able to transition from one program to another if they do it early enough so they don't lose time. We also want to make sure our students can transfer credits easily. A lot of students take classes in high school and get all these certifications that may help them get a job later, but they don't really prepare them for the work they're going to do at university. Becoming a medical assistant gets you some hands-on experience, but perhaps they're missing out on coursework to prepare them for that university college course. So we've got to learn to balance all this, and we do this through conversation with you, with everyone who is going to be interacting with these students. So what are the pathways? Our pathways are simply the different options students need to start checking off when they first make that decision to become a healthcare provider. But all of our pathways are built around meeting workforce needs. Let's face it, we need to diversify the healthcare workforce to truly improve the health outcomes, patient satisfaction, and patient communication that we desire when we interact with the healthcare provider. To do this, we need to have our own homegrown healthcare workforce. That way we will assure cultural competence, and they will play a crucial role in removing barriers to healthcare utilization. But how do we do this? What is our strategy so we don't have students that are lost, confused, or unsure? We need clarity and communication. Remember, our job here is to reduce that opportunity gap for students because of poverty, gender, race. I mean, we have some great students here in the Rio Grande Valley. And we know that talent is equally distributed. We've got great students at every school who will do well, but the opportunity is not always there. We want to make sure all of our students have an opportunity to get the education they want, to enter the career they want, where they can really change not only their lives and their families, but everyone's. So what are the pathways? Now, this is a huge graphic. I'm not going to zoom in on it, but these are just the multiple options available at UTRGV. As you go through the Pathfinders Academy, you will learn more about most of these programs. Some are coming in the future, but you'll learn a lot about these. A lot of what we see in that first big branch off of UTRGV, it's kind of hard to see, but these are our undergraduate degrees at UTRGV. American Sign Language Interpretation, Addiction Studies, Biomedical Sciences, Exercise Science, Rehabilitation Services, Health, Kinesiology, Clinical Laboratory Sciences, Communication Sciences and Disorders, Nutritional Sciences, Nursing, Social Work. These are all programs in the Division of Health Affairs that open the door for students to get higher education to become rehab counselors, teachers, physician assistants, doctors, podiatrists. The sky's the limit. And we want to make sure that you can help our students in these first steps of entering this pathway by educating you on what those steps are. And you're going to see videos and presentations and have a chance to interact with faculty and advisors from UTRGV as we go throughout this process. So you can learn more about our programs, what we expect, and how you can help us get these students ready for their future healthcare career. Now, what are some of our overarching themes in our pathways? We have to remember that health professional scholars, mostly in medicine and public health, but in other fields, they've identified and defined the social determinants of health that have resulted in so many health inequities in our communities. We build our programs around the social determinants of health because we want to level the playing field. Our current educational models make students believe that poor health outcomes are divorced from social, economic, political, and environmental forces that establish and maintain systems of inequality. And really, that's not true. They're all interlinked. We need to re-envision the health professions as to not only attend to disease, but to become a force in encouraging health. Our goal is to not just teach our students how to fix a problem, but how to prevent it. To achieve this goal, our themes in health education, in the broadest sense, need to be embedded consistently into the curriculum. We need to make sure that everything is built around the social determinants of health and preparing students so they have an understanding of what it takes to be a high quality, fantastic practitioner, no matter what field they choose. At UTRGV, and I'm going to move my graphic around here just a little bit so you can see everything. You don't need to see me, but when we look at this, we have a lot that we have to do to develop that future professional. We have to make sure they know how to work as part of an interprofessional team. They have to have both intra and interpersonal social skills. They have to understand economic health policy, cultural factors, and the social determinants of health. We also want to make sure that they have some research skills, that they've got great clinical skills and clinical reasoning ability. They know how to integrate and use data, and they've got to have a solid foundation in how technology is used in healthcare in every level. We have to make sure we integrate the family, that we offer mentoring and advising, and we avoid the so-called hidden curriculum. Not really avoid it, but bring it to the surface. It's one thing to become a doctor to learn all about the body and the disease process and how to correct it. But there are a lot of people out there who've got a great mindset, can memorize facts, and they know the body. But can they interact with the body, with the person? There are a lot of things in our curriculum that we have to kind of re-emphasize and focus on because they're getting a lot more than just learning about the body. We also have to make sure our students understand ethical decision-making, as well as statistical decision-making. In our current situation that we're all living through right now with COVID-19, we are inundated with statistics. But what about the ethical side of it? What is our social responsibility? How do we teach that to our students? And how do we teach them to advocate for their careers, for their profession, for their learning? To do this, we are developing and continually tweaking our curriculum so that our students have a core set of knowledge, skills, and attitudes that will lead them to developing a professional identity formation that is sound, that is well prepared for the jobs that they're going into. We just don't want to put out nurses. We want to put out the best nurses. We don't just want to put out a speech language pathologist. We want to put out the best. We don't want to just put out a generic exercise scientist. We want someone who can help train and educate the next generation. And we're going to help them do that at UTRGV. So back to the beginning, we've got some tools that you can use, and you're going to get a lot more throughout this program. But this is just a quick look at the pathways and what we mean when we are diving into this new experience of working with our students on their pathway to health.